Great. So now we're going to look at some process innovations to try and help Paul Kanoja get 6 surgeries. Um, I'm going to examine these process innovations through the lens of the 4 lenses. Our first one is utilization matters, and we'll consider the other 3, the pooling, the psychology, and the variance considerations in subsequent clips. So we have this as our base case result. And relying on theory of constraints reasoning around bottleneck remediation, I'm going to suggest that we add a cRNA in this pool here. Well, actually, we could just add a cRNA to the anesthesiology track to prevent the pooling, to not pool, because that's like a different category. So just to keep things simple, I'm going to add a cRNA in each of these tracks to see just in isolation what the effect of adding that cRNA is to my surgery count and my flow times. So I did get quite a lot of variation, but let's just sort of hang on to this one. I got 5 and 4, I think twice, and getting numbers here around 200 average. Okay, they basically statistically identical. I am getting different flow times because of the variabilities. Some can be less, can be more, but ballpark, just for the purposes of our comparison, our loose comparison, you'd have to build a more substantial argument with confidence intervals. So let's end this. Go ahead and add an anesthesiologist here. So I'm in simulation main now, and I'm looking at my parameters, and I'm adding an anesthesiologist, either an anesthesiologist to each track or a cRNA. Of course, different price points, but point is that I'm going to have backup there. So that person who is sort of essentially working all day is now going to have substantial relief, and probably you're going to see that utilization drop down to like 50%. So I'm going to run this one fast to completion, and got a little oddity here. You can see like a double bar. So in fact, I have 2 completions with flow times that are identical there. So in fact, I got 5 completions here and I got 5 completions there. So I want to, and my flow times are down from around 160 to about maybe 165 average roughly. Let's just verify this by running it a few more times. So I stop it, I run it again, and I run it to completion. Okay, and so I had again 5, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5, 6. Awesome. Okay, it's the first time we've seen a 6. And you can see this one had 158. So it just happened to be a very effective, very efficient sequence of surgeries. This one here is 172. So maybe still 165 roughly is where the average is. We'll do one more time. And I'll run it to completion, just in the interest of time. So here I had 5, and here I had 6. Okay, so this one's average probably 153, 154, somewhere around there. So definitely better than in terms of the flow times and the counts than the base case by adding these cRNAs to these 2 tracks. I appear to be getting an extra surgery, and I'm assuming that that's going to be across the course of a year. You make some assumptions around how many days of surgery there are, but it looks like we're going to be able to cover that salary, and you should, find some salaries appropriate to these different roles from Indeed or other sources. Okay, so that is our utilization matters first initiative. Now, I'm looking at this and I'm asking, what else could I potentially do? It seems like that move that we've just made by adding the cRNA made the most sense because that was the bottleneck. Right now, I have the ORs coming in at about 88% utilization, and the surgeons are somewhere in the ballpark of 92 to 95%, at least on this run. You connect these statistics across multiple runs and to get a better sense of how busy they are. But maybe adding a PA here as a next move might be beneficial. So let's just explore that. So I'm going to add a PA in each track. So the surgeons now are 2 and 2. So I've actually hired 4 people now, 2 CRNAs and 2 PAs. I'll run this. To completion. So 3, 4, 5, 6 here, and 6 here as well. Flow times are now in the 140s. Okay, so seems like I've got 6 and 6. Let's see if that's going to hold up. So I got 6 in A and 6 in B. Very interesting here. This is a bar that has 3 completions at the same flow time. So just read this carefully. The legend is not really indicating that, but you can see, you sort of visualize it. There's 1, 2, 3. So it's decisive here. 6 and 6, right? And the flow times probably 140 average something. One last time. And to completion again. 6 and 6 again, flow times in the 140. So I'm pretty hopeful here. The downside of what we did here is, there's additional payroll, right? You have to factor. So you need to do a little sum here to determine if this is actually to the advantage of the Hospital of Hipkins. Because the question is whether we're getting enough surgeries to compensate or offset the additional salaries. Okay, so this is the utilization matters idea, and you can explore other innovations, reduce processing times, because that would reduce perhaps the time the surgeon is operating, for example, relative to everybody else. And if you can come up with published research that supports those kind of claims, go for it.